Well, yes, the healthcare space will continue to be in focus from a budgetary standpoint given COVID-19. In fact, this would be the third budget under the shadow of COVID-19. While COVID-19 would be a larger theme that we could probably see in the budget, the important point to focus on would be the budgetary allocation towards healthcare, considering the out-of-pocket expenditure that Indian patients have. And remember that the larger goal of healthcare expenditure is to increase expenditure as a percentage of GDP when it comes to healthcare to around 2.5% from the current 1.5% that it is at. Well, from a COVID-19 perspective, watch out for any kind of fund allocation towards the precautionary dose opening up for all adults, as well as any kind of guidelines, initiatives towards the vaccination below the age of 15. So fund allocation, guidelines, roadmap, timeline on these two factors would be watched quite closely. Separately, healthcare infrastructure has really come to light with the COVID-19 pandemic, and hence any kind of incentives to encourage healthcare infrastructure when it comes to building hospitals, medical training of personnel would all be in focus, and to especially encourage it in terms of incentives when it comes to Tier 2 and Tier 3 cities. Well, yes, the government has already announced the PLI scheme when it comes to the entire healthcare space as well as medical devices, but any kind of further incentives to encourage API manufacturing in India as well as key starting material manufacturing in India so that we are not as import dependent would be something that the street would watch quite closely. Also encouraging R&D as a whole, considering the innovation landscape in India is not as much as the other countries, and there is a possible need to encourage that, especially post COVID-19. So any kind of incentives to do so would be watched quite closely. This can come in the form of incentives via tax, according to experts, in order to encourage R&D, especially in the country. Well, lastly, I would watch out for any kind of exemptions when it comes to GST on life-saving drugs, as well as any kind of relief measures provided for high raw materials that the industry is dealing with at this point in time, and also the indigenous manufacturing, encouraging indigenous manufacturing of medical devices, where we do import around 70 to 80% of our medical devices, but there is a PLI scheme announced for it, so any kind of additional measures would be watched out for. And on a larger scale, what we hear in almost every budget about disease eradication as well as the building of AIMS, etc., would be that something that the street would watch out for. So largely, do watch out for any kind of incremental measures to encourage indigenous production of APIs, KSMs, R&D, innovation, medical devices, as well as any kind of timeline in order to provide more perspective on the precautionary dose for all adults as well as for vaccination of children under 15.